Hey guys, what's going on? Happy Thursday. Brancho and Brown here, physical therapist and wellness coach with Get Your Fix Physical Therapy, Get Your Fix Nutrition, CrossFit coach at CrossFit Majestic. We're continuing on the knee series, or on the diagnosis series on why these different diagnoses are not death sentences to your training. So I've been working on the knee, and today specifically I wanted to go into pain that we get on the medial side of the knee, so that the side that touches the other knee, or that inside part. There's an area there where three muscles connect or combine to attach at the same spot, and we call this, as medical professionals, we call this the Pes Anserine. Basically, it's an area where three muscles come down to attach. One is part of the hamstring, one comes from what's considered your groin area, the other one comes from the outside of the hip, and all those converge in the same area. So why do we get pain there? Well, one, because there's muscles and tendons there, so anywhere we have soft tissues, anywhere we have muscles and tendons attaching, we can have pain. But the real question is, why does this pain occur? And a lot of this knee stuff, like I've been talking about, it really comes down to biomechanics for the most part. So if the foot and ankle isn't working properly, if the hip isn't working properly, that knee takes the brunt of it. So as we're walking, as we're running, jumping, squatting, you name it, if that knee rotates in at all, it puts strain on these muscles. Along with that, all of these muscles attach to your pelvis. So here's where this plays a role in a little bit as well. If you have any sort of what I call a pelvic rotation dysfunction, and by dysfunction I just mean it's not where it's supposed to be. If you have any sort of issues with that pelvis where the position's a little bit off, it can cause an abnormal either pulling or slackening, if that's a word, of those muscles. Anytime a muscle is not at the proper tension for what it needs to be to function, it can cause problems. And so a lot of times in this area, I'm looking at the pelvis to see how that positioning is. So what does this mean for you? What does this mean for your training? It means we just need to take care of the issues. As I always say, you don't want to push into pain. All training is going to have some sort of discomfort. We get aches, we get issues going on. If it's causing you to compensate, if it's causing you to limp, definitely want to modify what you're doing in order to perform these activities without compensations that can cause other injuries. But what we need to do is figure out what specifically is causing this, especially this one, because the pelvis and the spine can be involved. So it takes some time to weed out if it's the ankle, if it's the hip, if it's the pelvis, or if it's all of them. But it's something that needs to be addressed, needs to be looked at, and then we can get you back to your training. So if this is something you're dealing with, if you're thinking this is what's going on because of the pain you are experiencing, then definitely comment on here, put any questions you have regarding this on here. And as usual, if you have anything specific you want to reach out to me directly about regarding this, feel free to message me through Facebook Messenger. I'd be happy to have a conversation with you. So hope you're having an amazing Thursday. Have a wonderful rest of your day, and I will talk to you later. Bye.